I want you to know, the amount of compliments and shock people got when they heard I had cancer, because they said, you do not look like you have cancer. And I cannot believe you're 57.
Tell us what's your experience, your history.
So I've been frustrated because I have a genetic, I definitely have it genetically. I don't metabolize estrogen. And my oncologist doesn't know anything about that. They don't want to talk about genetics. And part of that genetics pulls the ovarian and the breast cancer together, stating you're going to get one or the other or both. And I never looked at my genes in that way. I looked at them for something else. And all of a sudden, when I got cancer, it was glaringly obvious when I ran the estrogen genes, because I have this website I belong to. It was, the chance was so high. It was double. It's genetic. It has something to do with a genetic gene about that metabolizes estrogen, and estrogen feeds for ovarian and breast cancer. Not a lot of genetic doctors that work with oncologists right now, unless you have that BRCA gene. And that's not what I have. I just have a gene that doesn't metabolize estrogen fast enough. The radiation, I heard people would get blisters and then it would break and then it just didn't heal right. Especially if it was under the breast and you're, large breast, I call myself a large chested woman. I can't avoid the fact that, it was rubbing on my brow all day long and I couldn't go without one. I tried wearing some different things, but, so I did, but it was definitely the serums that prevented it. It helped heal it. No matter what I was wearing, it was still healing. So other women didn't get that. They'd have blisters that just, like I said, they popped because the bra would rub against it. I was very pleased at how quickly my skin really wanted the moisturizer and took to it. I had burned like on half of my side, and I was neglecting a little bit of the other side that definitely got radiation. And once I started using it, really encompassing my whole area, I noticed a difference right away. And so when I would put it on at night, it was soothing. And in the morning, when I come out of the shower, my skin was, eager to moisturize. And I wouldn't have been able to sleep if I had such burns because I was uncomfortable from the lymphedema. I was sick from the chemo and I was having trouble. My skin wasn't bothering me. It was calm. But this is excellent. I mean, it was amazing. I'm really, really, I can't believe how lucky I am that my skin did not burn. But the chemo was affecting my face. And once I started using the other products, the hydration came back. My skin got a little plumpier. I wasn't having the puffiness anymore. I was using both products. I can't tell you how many people said to me, you had cancer? You don't look like you had cancer. How old are you? I'm like 57. You're 57? You don't look 57. So I was falling apart on the inside and my stomach's destroyed, but on the outside, nobody knows. Nobody knows. And I do want to say something else too. So a year prior to my diagnosis, I had shingles on my forehead. I'm sorry, it was like right here. It went like this, but some reason my forehead was getting really red spots. I don't know if you can tell. I used whatever you sent me and the redness is gone. And then I started using the NeoGenesis serum and face spray, recovery spray and the serum. And within a week, I think, I noticed it fading and fading. And I've always been good about skincare. And this is really a product that I don't want to stop using. So I really, really feel lucky. Thank you.